Welcome, and thanks for joining us. My guest today is Joni Huber, the Vice President and Chief Operating Officer at Compass Rose Health Plan. Joni, it's great to see you.
Nice to see you too.
So it is the beginning of open season. What distinguishes Compass Rose's plan from other FEHB plans that you want to make sure folks know about?
Sure. So really, we are all about the member. So we always put the member first, in decisions that we're making, things we're thinking about. At the forefront of our mind is always, what is it for the member? What does this mean for the member? So, really just putting them first and making sure the plan is what they need.
So it sounds like you really want to focus on customer service as you deal with those folks.
Right, customer service, providing benefits and different options that are best for them in whatever stage of life they may be in. So, even if they're not sick, even if they're healthy, we try to provide them with benefits and programs to keep them healthy.
How has Compass Rose evolved in the last few years to really meet the changing health needs of your customers?
Really, yeah. So Compass Rose has been around for over 75 years now. We were founded to serve the intelligence community, and for a long time we were a closed plan. So we'll often go to events or, open season in-person events, and people will ask if we're new, that they've never heard of us. And, really that was because we were a closed plan to a select number of agencies. This past open season we did open to all FEHB eligible employees and retirees. So that's exciting, and we just want to continue offering that coverage to the members.
You mentioned that you want to talk to their customers at all stages of their life. Are there benefits or features of Compass Rose that sort of fly under the radar and maybe could make a real difference for your members?
Sure. So one of the benefits that we offer is massage therapy. So people can get massages if they choose to with their health benefits, and we reimburse them for those massages up to a certain amount depending on what plan they're in. We also have coaches on our team that will help them stay healthy. Our high option plan has a rewards program that reimburses members for or gives them points for healthy activities, getting their screenings and things like that. So really, some programs that we think set us apart, but also that are intended to, incentivize people to keep them healthy, but also to use the health plan, if they don't normally have to use it.
So Joni, for retirees who are navigating Medicare, how does Compass Rose programs and plans coordinate with Medicare Part A and B?
Yeah, so a few years ago we put in a Medicare Advantage option, so members on our high option health plan can join Medicare Advantage, and this really was intended to help members get the most out of their dual benefits with FEHB and Medicare coverage. So it combines, again, their FEHB coverage with their Medicare coverage into one seamless plan. So they only have to carry one ID card, their provider only has to bill one insurance company. This plan also provides a great savings for the member. So in addition to mostly having no out-of-pocket cost for most covered medical services, we reimburse these members $125 a month towards their Medicare Part B premium. We give them $40 each quarter to spend on over-the-counter items to help keep them healthy, like bandages or sunscreen, heating pads, things like that are on top of their normal medical benefits. In addition, under the Medicare Advantage plan, they have dental and vision coverage, free gym membership, and they get significant savings on hearing aids. So, those are just a handful of the special programs and benefits that they get under our Medicare Advantage option. We do want to emphasize, because sometimes there is confusion around Medicare Advantage and, the commercials people may see on TV or the ads that they may get in their mailbox. The Medicare Advantage plans offered under the FEHB program are much different than those types of Medicare Advantage plans. So in these Medicare Advantage plans, you stay an FEHB member. If you're a Compass Rose, you stay a Compass Rose member. So really, you're not giving that up. You're simply just gaining a plan that gets you some more value.
It sounds also like a way to kind of simplify the navigation of all of those plans.
Correct, yes. For the member and the provider as well, it really makes it more simple.
So as you look towards the 2026 plan year, are there changes in Compass Rose's offerings that folks should be aware of?
Very little changes. So, we are maintaining our standard option, our high option, and then our Medicare Advantage option. that links in hand with the high option. So no big changes this year, but we would really just tell people, make sure you're looking at what's out there. Don't auto renew, explore your options. So, open season is the one time a year that people really get to change their health care if it's not working for them, or change their health insurance if it's not working for them. And even if your health plan is working for you, make sure you're comparing and making sure that you're getting the most value out of it, because without looking into it, you don't know what you may be missing. And OPM does have a really great tool that members can easily compare plans on. So we just really encourage people to do that during the open season time frame. And really, in addition to looking at premiums, we tell people to look at the plan as a whole. So, look at the network or the doctors that are close to you or that you like visiting in the network. Look at the prescription drug coverage, and look at additional perks that are offered. Like I had mentioned, massage therapy that we reimburse members for under our plan, but we also provide free virtual care, wellness coaching, and really benefits designed to support them through their whole life, so their whole health, so even when they're not sick. However, if they do get sick, they're covered too. So we have, low copays for office visits. Again, we have a team that can help guide them through the healthcare journey if they need it, or they need someone to hold their hand and kind of walk them through whatever they're navigating. So we just are there to support them really throughout their life.
You're suggesting a comparison that is value-based, not just cost-based, and that can be tricky for folks. Does Compass Rose have a helpline or a call-in, or folks who are available to help clients navigate all of those comparisons?
Yeah, so actually this open season we are hosting a live webinar. I will be on a lot of them, so we really walk you through the benefits, walk you through the programs, walk you through the extras of what you can get out of the health plan. Because it's live, at the end of the webinar, people can ask us questions and we're able to answer while they're on the webinar with us. So, whatever they may need clarification on. We do have a helpline, so if you visit our website, compassrosebenefits.com, you can find our email address, you can find a phone number, many different ways that you can get in touch with us to ask questions that you may need answering.
What are some of the most common questions that you get?
Really pharmacy related. So, is this prescription covered? I will say on our website, you can also go to the pharmacy calculator tool, which members can put in there, or prospective members can put in the medication they're on, what the dosage is, and it will tell them what their cost would be under the Compass Rose Health Plan. Is my provider in network? Same thing, they can go to our website and access the provider directory so they can see easily and quickly if their provider is in network with Compass Rose, which provides the most savings to them.
And your team can help them if they're in a different plan right now, think about what it takes to move to Compass Rose.
Correct, yeah, and it should be, pretty easy. I think it's easy for members and retirees. There's different ways that they can make that change, but yes, we could give them, kind of instruct them on how to do that.
Well, there's a lot of talk these days about healthcare premiums and coverage. What are the things you most want the federal employees to know who might be considering switching plans this year?
Yeah, really just look at, your total cost of care, if you will. So, outside of your premium, what's your office visit copay for your primary care doctor if you're sick, outside of your annual physical, because in-network preventive care is covered at 100%. If you go to specialist, what are those copays? Again, back to the medication piece, what is the copay for my prescription? So just, look at those on a high level, and then, dig into the benefits that you would like to get. So do you want a rewards program? Do you want coverage for chiropractic care, acupuncture? Just looking at the different things under the plan and see what the allowances are, what number of visits and things like that they allow a year to make sure you're really choosing the plan that fits your needs.
And why should Compass Rose be on their short list?
Yeah, really. Again, it goes back to the customer service. We really do pride ourselves in trying to provide the best customer service that we can for our member. Again, when there's decisions to be made, we're putting that member at the forefront, wanting to treat them like we would want our family member treated. So really, that is the biggest thing I would say about Compass Rose is really we pride ourselves on the customer service.
You really want to make them part of your family.
That's right.
I'd like to thank my guest, Joni Huber, the Vice President and Chief Operating Officer at Compass Rose Health Plan. I'm Terry Gerton, and you're watching Federal News Network. Now let me send you back to the studio for more on the Open Season Exchange.